Have you ever wondered about the common problems faced with nasogastric and enteral feeding tubes? Feeding tubes, specifically nasogastric and enteral ones, are essential tools in medical treatment, providing a lifeline for patients who cannot eat by themselves. They serve as conduits, allowing for the delivery of nutrition directly into the stomach or small intestine. Nasogastric tubes, often referred to as NG tubes, are inserted through the nostril, passing down the esophagus and into the stomach. They're typically used for short-term feeding, medication administration, or to remove gas from the stomach. On the other hand, enteral feeding tubes, also known as gastrostomy or jejunostomy tubes, are placed directly into the stomach or small intestine through the abdominal wall. They're more commonly used for long-term care, providing a more permanent solution for patients who need consistent nutritional support. These tubes, while life-saving, are not without their fair share of complications. It's a delicate balance between the benefits they provide and the potential problems they can introduce. These issues can range from minor annoyances to serious medical emergencies, and it's important for healthcare providers to be well-versed in both their prevention and management. Imagine a nasogastric tube dislodging and moving out of place, or an enteral feeding tube getting blocked, preventing the delivery of vital nutrients. Picture an infection developing at the insertion site, or the tube accidentally being removed, causing discomfort and potential harm. Even seemingly minor issues like skin irritation around the tube site can escalate if not properly managed. But fear not. While these problems can indeed be daunting, they are not insurmountable. With the right knowledge and skill set, healthcare providers can effectively prevent and manage these issues, ensuring the patient's safety and comfort. So, let's embark on this journey together as we delve into the world of feeding tubes. We'll explore the common problems encountered and arm ourselves with the tools and knowledge needed to overcome them. In the next few minutes, we will delve deeper into these problems and explore how to solve them. The first problem we are going to discuss is displacement. Displacement in the context of nasogastric and enteral feeding tubes is when the tube moves from its original position. This is a precarious situation, as it can lead to complications that could jeopardize the health of the patient. Let's delve a little deeper into how displacement can occur. It could be due to several reasons. For instance, the patient might cough or vomit, or there may be inadvertent pulling or tugging on the tube. It can also happen during patient repositioning or bed transfers. In some cases, an improperly secured tube can also lead to displacement. Now, why is displacement a problem? Well, when a tube is displaced, it can end up in the wrong location within the body. For example, instead of the stomach, the tube could migrate to the lungs, which can cause serious complications, such as pneumonia or even a collapsed lung. Imagine trying to feed a patient, and instead of the food going to the stomach, it ends up in the lungs. It's a very dangerous situation indeed. Another risk is that the tube could come out entirely. This not only disrupts the feeding process, but can also cause discomfort to the patient. Moreover, it means the tube will need to be reinserted, which is an additional procedure that the patient has to go through. So, what's the solution? Regular checks are the key. By monitoring the position of the tube frequently, healthcare professionals can spot any signs of displacement early on and take corrective action. The tube should also be secured properly to the patient using the correct type of securement device. This will ensure that the tube stays in place, even when the patient moves or coughs. In conclusion, displacement is a significant problem associated with nasogastric and enteral feeding tubes. But, with regular checks and proper securement of the tube, it is a problem that can be effectively prevented. Remember, early detection and prevention are better than cure. The solution? Regular checks and proper securement of the tube can prevent displacement. Blockage is another common problem with feeding tubes. Indeed, this can be a significant hurdle in ensuring the patient receives proper nutrition and medication. But what causes these blockages in the first place? In most cases, blockages in feeding tubes arise due to the type of food or medication being administered. Some foods and medications can be too thick or chunky, causing them to get stuck in the tube. Other times, the tube may not be properly cleaned between feedings, leading to a buildup of residue that eventually causes a blockage. The impact of a blockage on the patient can be quite severe. When a feeding tube gets blocked, the patient's food and medication schedule can be thrown off. This not only disrupts their nutrition and medication routine, but can also cause discomfort and stress to the patient. In severe cases, a blocked tube may even need to be replaced, which can be an invasive and uncomfortable process. But here's the good news. Blockages are preventable. The key lies in how we manage and maintain the feeding tubes. Regular cleaning is an absolute must, but not just any cleaning, flushing. To prevent blockages, it's recommended to flush the tube with warm water before and after every feeding. This helps to clear any residue and keeps the tube nice and clean. The warm water acts as a solvent, breaking down any potential blockage-causing elements. For medication, it's advisable to crush them into a fine powder before administering to prevent them from getting stuck in the tube. And it's not just about the cleaning. Paying attention to the type of food and medication being administered can also help prevent blockages. Opt for foods that are smooth and easy to blend, and avoid those that are chunky or fibrous. Remember, a little bit of care can go a long way in preventing blockages in feeding tubes. It's all about regular maintenance and being mindful of what's being fed through the tube. To solve this problem, regular flushing of the tube with warm water is recommended. This simple step can make a world of difference in the life of a patient relying on a feeding tube. Infections are a serious concern with any medical device, and feeding tubes are no exception. The human body is an intricate ecosystem, teeming with microorganisms. Now imagine introducing a foreign object into this environment, such as a nasogastric or enteral feeding tube. This can disrupt the equilibrium, providing an avenue for opportunistic bacteria to invade, potentially leading to an infection. Infections associated with feeding tubes can occur in several ways. For one, bacteria present on the skin can migrate along the outside of the tube and infiltrate the site of insertion. Alternatively, bacteria can also travel inside the tube itself, especially if the tube isn't properly cleaned or if contaminated food or medicine is administered through it. So how can you tell if an infection has occurred? Symptoms can vary, depending on the severity and location of the infection. Some common signs include redness, warmth, and swelling around the insertion site. The patient may also experience fever, increased heart rate, or even discharge from the site. If the infection spreads to the bloodstream, it can cause serious complications, such as sepsis, which can be life-threatening. The risks of infection are not to be taken lightly. Besides causing discomfort and pain, an unchecked infection can lead to prolonged hospital stays, increased medical costs, and in severe cases, can pose a significant threat to the patient's life. However, this is not to say that using feeding tubes is inherently dangerous. In fact, they can be a lifeline for many patients, providing essential nutrients when normal eating is not possible. The key is to manage the risks and take appropriate preventative measures. Prevention, as they say, is better than cure. Regular cleaning of the insertion site using sterile technique can help keep bacteria at bay. Practicing good hand hygiene before handling the tube is also crucial. And remember, if you notice any signs of infection, seek medical help immediately. Prevention is key here. Regular cleaning of the insertion site and proper hand hygiene can greatly reduce the risk of infection. Accidental removal is another problem that can occur with feeding tubes. This issue is not uncommon and can happen in various ways. It can be as simple as a patient being unaware of the tube's importance and pulling it out in an act of discomfort or confusion. It can also occur during routine care or movement when the tube gets caught or pulled unintentionally. When we delve deeper into the implications of accidental removal, we find that it's not just about the inconvenience of reinsertion. This mishap can lead to a multitude of complications. Firstly, reinserting the tube can be a stressful and uncomfortable experience for the patient. It can also pose a risk of infection, as any time a foreign object is introduced to the body, there's a chance of introducing bacteria along with it. More critically, if the tube isn't promptly replaced, the patient may miss vital feedings or medications, which can have serious health implications, especially for those who rely solely on tube feeding for their nutrition. In severe cases, the removal of the tube can lead to the closure of the stoma or opening, which might require surgical intervention to reopen. So, what can be done to prevent accidental removal? Well, it's a combination of ensuring the tube is securely fastened and education. The tube should be secured as per the manufacturer's guidelines to prevent it from being pulled out easily. Adhesive anchors or holders can also be used to keep the tube in place. Education is equally, if not more, important. The patient, if mentally competent, and the caregivers need to be aware of the importance of the tube and the potential harm its removal can cause. They should be taught the correct way to handle the tube, especially during activities like bathing or changing clothes. They should also be informed about the signs of accidental removal and what steps to take if it happens. In conclusion, accidental removal of a feeding tube can be a serious issue with potential health implications. Ensuring the tube is securely fastened and educating the patient and caregivers about the importance of careful handling can help prevent accidental removal. Skin irritation, while not as severe as other problems, can still cause significant discomfort for patients. When we talk about nasogastric and enteral feeding tubes, one of the common issues that often gets overlooked is skin irritation. This problem, although it may seem minor compared to others, can significantly affect the patient's comfort and overall experience. So, what exactly causes skin irritation around the insertion site? The culprit is typically a combination of factors. Firstly, the constant rubbing of the tube against the skin can cause friction, leading to irritation. This is particularly prevalent in patients who are restless or move a lot. Secondly, the moisture from saliva, sweat, or other bodily fluids can break down the skin's natural barrier, making it more susceptible to irritation. Lastly, adhesive tape, used to secure the tube, can also contribute to skin irritation, especially if the patient has a sensitivity or allergy to the adhesive. The effects of skin irritation extend beyond mere discomfort. If left untreated, it can lead to skin breakdown, infection, or even ulceration. This not only increases the patient's pain, but also poses a potential risk for more serious complications. So, how do we address this problem? Well, there are several measures healthcare professionals can take to prevent skin irritation. One of the simplest is to use hypoallergenic tape. This type of tape is designed to minimize allergic reactions and is less likely to cause irritation. Regular rotation of the insertion site is another effective strategy. By changing the location of the tube, we can give the skin a chance to heal and recover. Lastly, the application of skin barrier creams can also be beneficial. These creams protect the skin by forming a barrier against moisture and friction, thereby reducing the risk of irritation. Remember, while skin irritation may seem like a minor inconvenience, it can greatly impact a patient's comfort and overall quality of life. As healthcare professionals, it's our responsibility to ensure our patients are as comfortable as possible. To prevent skin irritation, the use of hypoallergenic tape, regular site rotation, and skin barrier creams can be beneficial. As we've seen, nasogastric and enteral feeding tubes, while essential, can present several problems. Let's take a moment to summarize what we've covered. First, we discussed displacement, which can occur when the feeding tube moves out of its correct position. This can cause discomfort and complications, but can be addressed by ensuring the tube is secured properly and checked regularly. Next, we delved into the issue of blockage. This common problem can be caused by various factors, from medication residue to inadequate flushing. The solution: regular and thorough flushing of the tube, as well as careful administration of medications. We also looked at the risk of infection. This is a serious concern because it can lead to severe health complications if not addressed promptly. The key to prevention here is stringent hygiene practices during all procedures involving the feeding tube. Then, we touched on accidental removal. This can be a distressing situation, but it's preventable through careful handling and secure placement of the tube. And remember, if the tube does come out accidentally, it's crucial to seek immediate medical help. Last but not least, we discussed skin irritation. This can be a source of discomfort for the patient and can be exacerbated by poor hygiene or improper tube placement. To prevent this, it's important to ensure the skin around the tube is cleaned regularly and monitored for signs of irritation or infection. Throughout all of this, it's clear that the proper care and handling of feeding tubes is of utmost importance. Each of these problems can be mitigated or even prevented entirely with the correct procedures and awareness. But what's also clear is that no solution is one size fits all. Each patient is unique, and their care should be tailored to their specific needs and conditions. It's a delicate balance, but one that's absolutely vital to the safety and comfort of patients relying on feeding tubes. By being aware of these issues and knowing how to address them, we can ensure the safety and comfort of patients relying on feeding tubes.